one of your, guys, this is one of your testable skills. I know this is the first time you guys have really gone through this, so I'm just going to go through it nice and slow and break it up. Again, this is really similar to your, patient assessment medical, for the most part, especially up to priority patient. Okay. So the very first thing, like all 7 other skills, we're going to start with?
BSI.
Nice, nice. BSI, scene safety. So come in, BSI, making sure my scene is safe. All right. For trauma assessment, let's say before I get into BSI, scene safety, let's say I'm arriving to an intersection where I have a pedestrian versus vehicle accident. I have a pedestrian laying in the middle of the intersection, laying supine just like this. So that will be kind of like an introduction you'll have, and then you just start with your assessment. So again, BSI, making sure scene is safe, especially with someone in the middle of the intersection. What do we want to make sure? What do we make sure about the scene? It's secured, right? Making sure the intersection is blocked off by PD. All right. What's the next thing we're going to do? Determine if this is a what? Nature of illness, mechanism injury. We said this is a vehicle versus pedestrian, right? So this is a mechanism of injury. Okay. And the mechanism is what? The vehicle, right? Then what are we doing after that? Number of patients. I have 1 patient. It's what you see, okay? Now, could the scene have multiple patients? Of course. But let's say for this assessment, we have 1 patient. Then what are we going to do? Consider additional resources. What could we consider with a patient like this? ALS. Good. We could also consider there's a vehicle involved, fire, police. I already have police blocking off the intersection.
Could you consider like life flight?
You can, but at this time, I wouldn't get too into that. But you can consider that if you need to.
For the test, you're going to say consider additional resources.
Yeah, I'm just going to consider additional resources. And then at this time, I'm going to consider C-spine. You know, I know you guys, I've told you in the medical assessment to consider it, but this is the time where you're not going to consider it. You're actually going to get your partner to help stabilize your head. With this patient assessment, I want you to pretend you have as many partners as you want. So I'm going to take my invisible partner, put him at the top of his head, keep it in line, neutral position. Does that make sense? Okay. So once I do that, what's the next thing I'm going to do? Go to my primary assessment. So I already did my scene size up. Again, I'm just verbalizing. Then we go to my general impression. Now I'm looking at my patient. I have a mid-20-year-old male laying supine on the ground. Appears at this time unstable. Because why? It was just hit by a car. So at this time, I'll consider him unstable. All right. Then once I have my general impression, what's the next thing to do? Determine chief complaint. So I'm going to come up, hello, sir, can you hear me? He doesn't respond. Then what am I going to do?
Parent life threats. Look for bleeding.
AVPU, right? So in the AVPU, A is what? Alert. Hello, sir, can you hear me? He doesn't respond. Then I did alert, and then the verbal. He didn't respond to my verbal, so I'm going to go ahead and do painful stimuli. So where do we do painful stimuli? Trap. Good. So just give a good squeeze like that. And what did you just do right there?
Moved away.
He moved away, which is, what's that word we like to use? Withdraw, right? Withdraw. Good. So at this time, I have my LOC. So he's what? A P on AVPU. What's a GCS? Let's break it down first. Eyes is what? His eyes right now are what? 1, because they're closed. Verbal. What's his verbal? 1, because he didn't answer any of my questions, right? And then what's his motor? 5. So he withdrew. 6 would be what? If he's followed my commands, right? 5 would be what? Localized, right? What's localized? If I pinched him,
he grabs you towards
he tried to brush it away.
Yeah, he pushes me away. That's localized. But what did he do?
He
withdrew.
So he's a 4.
Decordized.
So 4, 5, and 6. So he has a GCS of 6. Okay? Does that make sense to everyone? Okay. So on test day, that's what you'll do. If you need to break the math up in your head, you can say, I got my eyes are 1, I got my verbals 1, and I have my motor as a 4 for a total of 6. Okay? Then once I have my GCS, I can also say at this time, looking for any apparent life threats. You can state that. Then I'll go, what's the next thing I'm going to do from there? After I got my LLC.
Airway.
ABCs, right? First thing I'm going to come up and check his airway. With a patient like this, how would we open the airway?
Jaw thrust.
Jaw thrust. Why wouldn't we use a head tilt?
Because spinal
Possible
compromise.
spinal injury, right? We don't know yet, okay? But we're just gonna do the jaw thrust maneuver just to be safe, okay? Does everyone understand? So I have my partner doing a jaw thrust maneuver. How else can we, what else should we check in the airway?
For any like.
Yeah, broken
suction.
teeth, anything in his mouth. So I'll just do a quick examine of his mouth, make sure there's no broken teeth, any kind of fluids, blood, vomit, anything like that. If there was blood or vomit,
Suction.
what am I going to do? Suction. For an adult patient, how long are we going to suction for? No more than 15 seconds. And we always suction going out, right?
Right.
Never suction going in. Okay. Once I check that, then what's after A? Airway. Breathing. I'm going to assess the breathing. I'm going to assess the breathing, and when you say that word, I'm going to assess the breathing, the proctor is going to say something to you. Proctor is going to give you a rate and a quality, okay? Let's say he says 6 and shallow. What does that mean to you guys?
Positive pressure ventilation.
Positive pressure ventilation with what kind of device? Background mask. So I'm going to hook my VBM, 15 liters high flow oxygen, and then am I going to insert an airway from
Yes.
the patient?
Yes.
What kind of airway?
Oral pharyngeal area.
An oral? If they don't have a gag reflex, if they do have a gag reflex, what do they do?
Nasal airway.
Also depends on if they have facial trauma too.
Right, right. If you are going to put, she made a good point, if you are going to do a nasal, you want to examine the face, make sure there's no facial trauma, and because that is what, a contraindication?